Hi, everybody. I'm Steve, here again with Dr. Nario. Dr. Nario, as you all know, if you've been watching the channel, is with Biointegrative Health Center in Reno, Nevada. They do all kinds of treatments and IVs and things like that. So you can check them out online. It's Biointegrative Health Center. Welcome, Dr. Nario.
Hi, Steve. Thank you for having me again. Always a pleasure.
Okay, let's talk about quercetin. Um, it's a treatment you do or a supplement. Well, you tell me, what is it?
Steve, quercetin is actually now something that is very famous, and I'm sure people out there who follows COVID would know this. But anyway, so ever wondered what makes vegetables and fruits have color? Why grapes will be purple or green?
I
Why
wonder that all
onions
the
are red?
time. I do wonder
Huh?
that all the time. Yeah,
All the time. Always a common question that pops in your head, right? Well,
right.
it's because of the pigment that it has on the surface of these fruits and vegetables. And quercetin belongs to this group of plant compounds called bioflavonoids. And quercetin is the most abundant bioflavonoid in our diets. And estimated that an average person probably consumes 10 to 100 milligrams of it every day through various food sources. And if you are a plant eater, you definitely are consuming more of this than anybody else. So foods commonly containing quercetin would be onions, apples, grapes, berries, broccoli, citrus fruits, cherries, green tea, coffee, and even capers. Most commonly found in red onions and red wine. So everybody who drinks wine, getting your bioflavonoids through that. And it's widespread in the plant kingdom. And you can even find it in even iceberg lettuce. Also available as a dietary supplement in powder or capsule form, but lately was made famous by the Frontline COVID-19 Critical Care Alliance, or FLCCC. They are a group of physicians who are actually making a protocol for COVID prevention or even COVID treatment.
Okay, so you talked a little bit about something it's used for, but what are the basic benefits of quercetin?
Well, Steve, lots of benefits. Think of plants and what they bring to the table. They act as an antioxidant, neutralizing free radicals. The chemicals, which are byproducts that harm cells and also damages DNA. And another famous use for quercetin, it's an antihistamine, a natural antihistamine, meaning allergy relieving, and it's also a very potent anti-inflammatory. Things that we use it in the clinic, in the clinical setting, would be cancer. It lowers the DNA damage from the carcinogens, and studies of this have been actually been showing how meat can be a carcinogen and how vegetables can act as an anti-carcinogen when you eat vegetables with your meat. So that was the study done, and it actually had proven to lower cancer risks. It's also an immunomodulator, significant in terms of the capability to interfere with the SARS-CoV-2 replication, with the results showing this to be the fifth best compound out of all 18 agents tested. So that's how powerful quercetin is against COVID-19, according to medical studies. And for our athletes out there, I use this a lot more for cardioprotective, meaning antioxidant characteristics of quercetin neutralizes the free radicals in the system from excess exercise. And also, these free radicals can destroy arteries that leads to inflammation and plaque buildup.
Okay, so are you saying that it can prevent viruses or sicknesses? It's a preventative type thing?
Right. So with the FLCC recommendation, FLCCC, three C's, they actually recommend this prevention to be taken every day. And later on, I'm going to give you some of those. And then also, when you have actual COVID, they have recommendations for it and also specific dosing. So either way, and now as we hear the rising of the counts again, for I think it's B5 variant of the Omicron, this is something that you would see being used by many.
Okay, so um, used by many. How do you use it? What form can it be taken in? How do you use it? How do you get it in your body? Do you just eat vegetables of all kinds, or what are my options if I wanted to use this?
Well, Steve, that's a great question, and that's where we come in. So, in general, when you use quercetin, always take vitamin C with it because it makes it more potent and it fixes, of course, fix your leaky gut if you have, let's say, abdominal symptoms, constipation, because that also will help for better absorption of quercetin. And all right, let's go for the common thing that I usually encounter here in the clinic. I give it orally, which is again now you were asking about the specific recommendations, 250 milligrams per day. Again, this is in accordance to the FLCC recommendation to prevent in relation to COVID treatment prevention, which is every day you take it. And when you have the actual COVID condition, it's 500 milligrams per day. So you increase and double that dose. And along with vitamin C, as I mentioned to you, 1,000 milligrams 2 times a day. And again, all in accordance with the FLCC program. For allergies of patients, I give them 250 milligrams 3 times a day. So it can be a good controller around the clock when they're outside, interacting with the pollens and also the environmental stimulants. In our practice, IV form is present. And again, as I mentioned to you, there's nothing that can beat the bioavailability of an intravenous medication compared to oral. And again, studies have shown very safe and well tolerated. Again, another clue for us is when so we start patients with oral quercetin first to see if there are any allergic reactions, because of course we will not give the IV just because of proven allergic responses. And I use this in our practice for cancer, allergies, COVID long haul, according to the FLCC program, and for our athletes. So this is a good combo that we give for athletes, for example, who has bad allergies and also who has actually have over-exercised themselves to produce more oxidative stress. And that's why it's a very good combo for these types of athletes. And again, yes, medical supervision is needed. We give lab requests for this to see how the kidneys are faring because kidneys metabolize this medication. But again, very safe and very beneficial for all our patients here.
Okay, so I have one more question. So, what is this something that you could take, like for instance, me, a healthy person? If I was going to take this, is this something that I would take once a month, or is this something that as far as a protocol, would I take it 4, 5, 6 weeks in a row, or would I take it once in a while? Someone
Mm-hmm.
like me, a healthy person, how would I get the IV?
Right. So the IV definitely is something that I would recommend at least once every month for somebody who's healthy, especially. But now you have to remember the Omicron variant is actually starting to go higher and higher. So this is part of the building that immune system, meaning when I say it having a bigger role now, I myself take it orally every day and I'm doing that 250 milligrams to 500 milligrams once a day for prevention. And for an IV for healthy individuals, once a month will be good. But back it up with the oral dosing as well.
Gotcha. Okay, that helps. Dr. Nario, thank you for your input and insight on quercetin. If you guys have questions or comments or anything you'd like to know about that, you can leave it in the comments section and we'll get back to you on that. So thanks for the information. Dr. Nario, Biointegrative Health Center in Reno, Nevada. Thanks for being with us.
Well, thank you, Steve, for the invite again. Always a pleasure. And as we all know, knowledge is power. And thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.